Assalamu alaikum. Welcome viewers, I'm Dr. Rubina Hossain, psychiatrist, Bangladesh Psychiatric Care. Personality, a very commonly used term, very well known to all of us. What is this personality? Personality is how you behave, your acts, your thoughts, your actions, which is more or less consistent in every situation. You may be an introvert or an extrovert. You may be shy, you may be friendly, you may be confident, charming, you may be irritable, impulsive. So every person has his own unique personality. So when do you know you have a personality disorder? When your thoughts, your actions, your behavior is so different from others in the culture that it is causing distress not just to yourself, it is hampering your daily life, your relationship with your friends, your colleagues, your family, it is hampering your studies or your work. That is when you may have a personality disorder. There are different types of personality disorders. Today, we're going to talk about one of these, borderline personality disorder. Borderline personality disorder is a pattern where you have unstable relationships, extreme mood fluctuations, extreme impulsivity, and a disturbance in your identity. It is more commonly seen in females, but it can occur in men too. It usually begins in the early 20s or as early as teenage years. So, how a person with borderline personality disorder behaves or acts? First, they have this constant fear that the people around them will abandon them, will leave them. Sometimes this fear is real, but sometimes they're imagined. Whatever the reason is, you get very desperate to stop this person from leaving you. You cry, you beg, you humiliate them at times, you threaten them at times, you sometimes become violent or aggressive, but all this is just a frantic effort to stop that person from leaving you. You get very impulsive, you take very rash decisions about abusing drugs, sex, spending money, driving recklessly, binge eating. All these decisions, you know that they have a painful consequence, but you still take them. You repeatedly hurt yourself, harm yourself physically. You cut your hands, you slit your wrists, or you take a lot of sleeping pills together. You have this constant suicidal thoughts, or you carry out these acts, or you tell other people that you're going to commit suicide repeatedly. You have an extreme and uncontrollable anger. You get angry out of proportion in every little situation, and this anger is very intense. You have extreme mood fluctuations, like suddenly you're very sad or you're irritable or you're angry, then after a few hours you're absolutely normal. In any stressful situation, you have this paranoid ideations, like paranoid ideas that the persons around you do not like you, they despise you, or they want to destroy your reputation or harm you in any way. So in some stressful situations, you get very paranoid. Unstable relationships. You have this pattern of intimate relationships where the same person you idolize at one point, and at another point you devalue them, you start hating them. So this pattern you have with most of your relationships. You have a disturbance in your identity. You feel that you do not know who you are. You do not know where you belong, what you want to do. You have developed a pattern of intimate relationships where the same person you idolize at one time, you feel that everything about that person is perfect, they're next to God. And then the same person, you devalue them, you start hating them. And this pattern occurs with many relationships in your life. You have a disturbance in your identity. You feel like you do not know who you are. You do not know where you belong. All this, or many of these symptoms, can occur in a person with borderline personality disorder. If you feel that you have these symptoms, then please contact with a psychiatrist, talk with a psychiatrist, seek help. Remember, if you want the people around you to change their behavior with you, then you need to bring a change in your behavior first. Thank you.